Hi, my name is Shagun Punani. I'm from Karnal. I live in Australia, Melbourne. I'm 34 years old. I was 132 kilos before I got the surgery done. I got mini gastric bypass on 27th of December. And I've lost 9.2 kilos and today is 4th of January. So yes, the weight loss journey has begun and hopefully it takes me further. I have been gaining weight over the last 15 years. So it was gradual, but at a point when I was 120 kilos, it became a struggle. 130, I had a lot of weight on my knees, and I sort of played table tennis, so that was very, very difficult. I knew what to do, but it was very difficult to do it. I couldn't walk, I couldn't climb stairs. That was very difficult. Earlier, I used to, even when I was 100 kilos, I could run on a treadmill for 30 minutes without a break, and that was easy. But recently, I got on a treadmill and I couldn't do 3 minutes. So, and I was out of breath. I thought something might happen. So I had to stop. And that was also a sign that I do need to reduce weight. I knew that I need to reduce weight, but due to my work and this, I was pretty busy. So I thought I neglected it for quite a while. And then COVID hit. I neglected it a bit more. And we were all home, eating this, that. I gained a lot of weight. So yeah, this might, this will help me reduce weight a lot. And I've already seen the signs for it. I've lost 9.2 kilos in 7 days. This is my 8th day, and I took my reading today. It was 122.8 kilos. And I was 132 when I started. Initially, I didn't want to get the surgery done. I didn't plan for the surgery at all. But after I spoke with Dr. Amit, he convinced me in 1 hour, which nobody convinces me in 1 hour. So yeah, that was great. As soon as I left here, I knew I had to get the surgery done, and the very next day I booked in for my surgery. In a couple of days, I got the surgery done. The process was fairly easy. The surgery got done in a couple of hours, and then my recovery time was 3 days. But I started walking after 3. Actually, I started walking when I was under anesthesia. So yes, it was pretty easy go. No issues whatsoever. Energy level is fine, even if I'm on liquid diet at the moment, but energy level is fine. I'm not feeling anything. I'm not feeling any sort of weakness. I'm not out of breath. I walk 6 kilometers. I sometimes push myself to walk 8 kilometers a day, and I'm only a week out of surgery, and nothing. It's all good. Yeah, got a lot of fat that has been burned to give me that energy. I've got a lot more left. So yeah, energy levels are high. I'd say high.
So how difficult you say the surgery was?
It's pretty easy.
Painful and difficult?
Not painful at all. You probably feel that you've got let's say 4 stitches. On the very first day, you'd probably feel that you got 4 stitches because they're very fresh. But on the second day, you might not even realize you got any stitches. So I went back home. I didn't even realize I had any stitches. I sleep on my left side. I slept on my right side. I slept like I sleep, and no problems whatsoever. Team is wonderful. The hospital was great. The nurses were awesome. They are always there. You've obviously got a button, you could call them whenever, but you don't even need to call them. They're always checking up on you, which is good. For the first time, and I've had experiences with doctors before, for the first time I've had a doctor come to my room in the morning and at night after he leaves his practice, which is great. That's all you need. Contact CODSILS and yeah, get an assessment. You don't have to get a surgery done. You have to get the surgery done. That's up to you. But if you get an assessment, you probably understand what is required and what are you required to do about it. So that's the main thing. As long as you understand, that these are the options available, and it won't harm you in any sort of way. As I said, I against surgery, but I got it done. So yeah, if I can get it done, anybody can get it done.